good morning, happy holidays. That was wind sauce. One more time, happy holidays. That's better. Thank you so much for coming out. And welcome to the Micronesia Mall. Welcome to the Center Court. And most especially, welcome to what can truly be a very amazing educational experience. Of course, this is Guam. We're all hard workers here. Some of us have been working since we were 2 years old, boy. And that does something to your back, right? Today we're going to be talking with two amazing neurosurgeons who are going to dissect and look at this a little closer for us. Today we're talking the aging spine. We're understanding changes and most especially we are finding relief. Again, as I mentioned throughout the morning, we'll be doing a short Q&A right afterwards. So if you've got questions, feel free to hold on to them during the presentation. And we'll come to you with our microphone afterwards so we can get the docs to chime in on that. But if you're looking for more personalized and more in-depth answers and obviously more help, you can check out our neurology table over there and sign up. And we'll be able to contact you and set that up for you down at the Guam Regional Medical City. Are you guys ready to get started?
Yeah.
You guys, it's Saturday. It's good to be here. One more time, are you ready to get started? That's better than a hero car. I love that. Ladies and gents, without further ado, I'd like to welcome to the stage an amazing member of our team at the Guam Regional Medical City. Please welcome Dr. Dulebohn.
I'm looking forward to today's presentation and having my partner, Dr. David Ye, help talk to us about some of the solutions that we now have for taking care of spine a lot easier than what we had done. Is this closer? Oh, I'm sorry. Okay. So again, myself and my partner, Dr. David Ye, over there, he'll be up in a few moments, trying to really help solve people's problems, lace them basically, and try to make them better. Dr. Ye is also a consultant for Centennial Spine and Extent, and I'm a physician, I'm a consultant for Medtronic, which is one of the end-stage therapies. We might be able to talk to you a little bit. We both work for GRMC. I've been here since April of last year. I came before the storm and enjoyed the storm so much that I decided to stay. It was actually the way everyone took care of each other. It was so impressive to me. So, we're going to talk about integrating innovative techniques and try to emphasize a patient-centered approach and how we can help treat. Next time. So ProFlex is one of the devices we're going to talk a little bit about, and the nifty thing about it is a lot less than a fusion, and really is remarkable in that you get all of the benefits and none of the downsides, really, and better maintained than even a laminectomy in terms of happiness. Rarely we have to do a fusion. And if you do, this device has actually been shown better than screws and rods that you may have heard about. It really is remarkable. And then, of course, in the neck, we have cervical discs. And the disc company we use has 4 different prostheses, depending on the anatomy. We were able to choose that at the time of surgery to try to get people motion back in the neck and maintain it. And we've even done it in 80-year-olds. So it doesn't really matter what age you are, it matters more what your anatomy is. And then I do a lot of stimulation to try to help patients who have had surgeries that may have not gone well or have chronic problems such as diabetes and they have a terrible neuropathy. We put a stimulator in to help them with their burning, tingling pain and get them more mobile. So I really think it's wonderful that GRMC has been willing to help invest in myself and in Dr. Ye in giving us really something that's not been available at all on the island. More comprehensive spine care that is indeed minimally invasive. So, I'd like to introduce Dr. David Yang. David and I have worked together and separately for more than 20 years. He was originally in Katrina, and then that storm there blew the town out, and he ended up moving to Johnson City, where he and I worked together for several years, and then back down to New Orleans, and now he's in California, and he's here as well. So the two of us together are doing what we can to help.
Thank you, everybody. Thank you, Dr. Dulebohn. We're having a little IT trouble, nothing unusual, but that's correct, right? These aren't going into patients. So I'm so delighted to be here from California to help out with Dr. Dulebohn and GRMC and the Sping program. We're going to show you a few ideas on things that we can do. Show you some few ideas of some techniques that we can use to help. But the biggest question really is this: what does it mean to be aging? And if you look at your own joints in your hands, you see how the knuckles get bigger, and so that's basically the same idea in the neck and the back. The problem there is when the knuckles, the joints get bigger, they start putting pressure on the nerves. And usually that manifests itself in pain in the neck that shoots down into the arms, weakness in the hands. Same thing into the legs, numbness, tingling. You find it more difficult to get out of bed, and it can be very, very tricky and slowly developing over time. So then the question becomes, what do you do about it? And we're neurosurgeons, so we see you at the very end of that ladder where you actually need us to change the pressure. We need to take out the pressure and then somehow give you stability there. But before you get to us, there's a whole line of things. We call it a spectrum of care. So the first thing you might do is go to a massage therapist, or maybe get acupuncture, or have gentle chiropractic therapy. So this is usually what we call conservative care. You may take Tylenol or ibuprofen. And you want to do that, of course, before you see a surgeon, because that's the last thing you really want to do. So if all those things fail, and then day by day you feel like things are getting worse, then what do you do? Then the next step really is to seek medical help, and that usually is your primary care doctor. And that person is the entry portal, nurse practitioner, physician's assistant, or doctor, to understand what the problem is. Sometimes it could be something else. Sometimes if you have low sodium or low potassium, that can cause these symptoms. But oftentimes, and we say 1 out of 5 people over the age of 60 is affected by stenosis or tightening of the nerve roots, that's the problem. Then they will refer you to get some type of picture of your back. So there's a couple different pictures we can get. One is an x-ray, and we've all had x-rays before, and that shows just kind of a broad view of what the back and the neck look like. A more detailed x-ray, 3-dimensional, is called a CT scan. And so that can also give us more information. And then the third thing, and you've heard about this, is called an MRI. And an MRI is really a test that gives us a 3D picture on how the nerves relate to the different discs and things like that. So once we correlate all of those things together, then if they find a problem, they'll refer you to talk to Dr. Dulebohn and myself. That's when we examine you. We listen to what you're saying and see how you're moving and how you're feeling, and then based on that, we start thinking about how to correct those problems. And it's always really 2 things. Because you're moving too much, we have to make sure that as you're moving, the nerves are protected. So you have to take pressure off the nerves, and then in doing so, if you take too much pressure off the nerves, remove too much bone and joint, then how do you make sure that you can still walk and be active? So those are the things that I think we specialize in. And as soon as we get the projector up, we can show you some of the pictures. There are some brochures and pamphlets that are in the desk over here that discuss different things. And what Dr. Dulebohn just said was, when you saw the Coflex device and the ProDisc device, previously we didn't really have any opportunities to continue to allow you to move normally. So when we took out too much disc or joint, then we only had the opportunity to put screws and rods in and fuse you. And no one wants that, because the whole point of life is to move. So now we are bringing to Guam, really for the first time ever, motion replacement. You want?
And when you're fused, the levels above have to work harder. If you grab your fingers and then say use your hand, you're going to have a hard time. And that's the reason why we really try very hard to avoid a fusion. But you'd like to keep the stability and have the ability to still bend and move. And that's one of the real advantages that we have with the extent or the disc replacements. So, the other thing that we really emphasize is getting people home. People come in for these surgeries, go home in a few hours, and are up and around right away. Oh, I'm sorry. This one's turned off, so I have to try to keep the noise to a minimum. In any event, we try to essentially replace the movement by making people stronger, better than they used to be.
So, when you think about spine surgery, you don't want it. And so there's always this fear, if you come and see us, you're going to buy a car and you don't want that car. So it's important to know that that's no longer always the case. You get to a point where your life is not good, you don't like the way your arms and legs feel, you should feel comfortable saying, let me get an opinion. And that's what we'd like to really offer for you, a kinder, gentler approach to it. To say, hey, look, it doesn't have to be a terrible experience to have spine surgery. So where I come from in Central Coast, California, I typically will do 2 or 3 surgeries in the morning, and they're smaller procedures, small incision surgeries. The patients are usually at the outpatient surgery center or at the hospital, and 90% of them go home that same day in a few hours. And they talk about it as a miracle because you've made a good incision, you've taken the pressure off the nerve roots, and then you've somehow stabilized it so their neck or back can still move. And we get so many accolades. Where I live, people give wine, for gifts, which is nice, right? And before we started doing these procedures, people would give me some flowers or chocolates, but now I get cases of wine, cases. Right, so when that started happening, I realized that we were onto something. And over the years, Dr. Dulebohn has been focusing on this type of less invasive, smaller incisions. And we're really pushing and pushing. And finally, I think we have a great, really portfolio of products for you to enjoy. So how does it start? Well, again, you still have to get through all of those conservative things. But we know it affects pretty much everybody sitting here, myself, Dr. Dulebohn included. So once you get to that point where you need help, then what do? They
get a referral to us, they usually get imaging, and then we're happy to see them.
Right.
And then an exam leads to where we're going to go. So we want to involve the patients in the decision-making process. We are not you've got to have this. It's a discussion. We're trying to make things better for you. So initial history, non-surgical treatment, and then patients involved in the decision-making. So let's go on. Low back pain.
Okay, so we're online. So this is low back pain, and this is the workhorse of your spine. It has all the weight, and you see the different structures. Next slide. So these are two pictures, one on the left that shows a normal back, and then Dr. Dulebohn will show you the problems that as we get older, the facet joints and the ligament get thickened and put pressure on the nerve.
It makes the space a lot smaller.
Right. Next slide. So then you get the x-ray I was talking to you, and this is absolutely what you hope your x-ray doesn't look like, right? And this is what you dread, and that's why you would never ever want to call and talk to us. But I promise you, this is necessary sometimes, but we would never ever think about going to this type of procedure first. Next. So then we get a CT scan. Like I said, a three-dimensional x-ray, and Dr. Dulebohn will show you where the bone has been removed to take pressure off the nerve, but that's not a really great solution either, because look what happens on the other side where the bone has collapsed. So
There's no support.
no support. Next. So finally, this is the MRI, and so we will go over with you the pictures, and they will look something like this. So you see the tightness on the nerve being pinched, right? This is classic lumbar stenosis. So when we talk about it, the numbers keep going up. And so as we look at this problem, there are really only two options: take off pressure in the nerves, or if you do too much, then fuse with the screws and rods. But now we're introducing this product, which is not new. It's been around for years and years, over 250,000 implants in the world, called the Coflex, but new to the island. Next slide. So we see Coflex actually being in between, where we can get the pressure off the nerve roots, allow you to have more strength, allow you to have less pain, more sensation, but then we stabilize so you can still move. Coflex has a bunch of papers written about it. These are scientifically proven devices that improve people's quality of life. And again, as of now, over 250,000 implants in the development. So nothing new, nothing experimental.
But the important thing is, back in 2018, it was shown to be better than a decompression alone.
So this is another picture of a case I wanted to show you. And the reason I show you these is not to scare you or not to make you nervous, but there are techniques that we've used in the past as surgeons, and we haven't done a really good job of what? Making patients happy. So here's a patient, and Dr. Dulebohn will show you where the bone has been removed to take pressure off the nerve. And then this is a patient seeing me in clinic, and you can see it's accentuated the bones above, and they're not really happy. Now, they are better, the nerves are better, but you ask yourself, is there another way? Next picture. So here's a patient, and Dr. Dulebohn will show you the L4-5 stenosis, where there's pressure on the nerve root, right? That's tight. And you can see the pinch on the nerve root there. Next slide. And then he had a procedure where they did a decompression and they decided to do a fusion. So this poor man comes and sees me in clinic, and because now the screws and rods are so rigid, he immediately breaks down above. And you can see in the MRI where there's just not enough space now. And so these are the stories that you see and you say, I will never, ever, ever have back surgery. Okay, but so here's a 79-year-old person who comes and sees me, and he's miserable. He can't golf anymore, quality of life is down, and as Dr. Dulebohn shows you, there's the disc herniation there, a pinch, and you say, well, that's not too bad, but it's like having a popcorn kernel in your tooth. You can't do anything because the nerve is always bothering you. Next. So this is a 45-minute procedure. The patient was home within 3 hours after surgery, and you see how the Coflex still allows him to bend back and forth, right? But don't take my word for it that this works. So he says, Dear Dr. Ye, it was a pleasure seeing you today in my follow-up appointment to my April 2019 Coflex implant. 6 months after surgery at 79 years of age, I installed 500 square feet of sod in my yard. You said you would not have approved of this project, and I told him not to do this, but I felt so damn good I had to do something physical to enjoy the freedom of being pain-free. I thank you for adding these days to my remaining years. See you next year. Happy holidays. Right? I mean, that's what we want to see. That's what you want your back surgery experience to be. Next. So here's a case. This is an architect. He's not a healthy man. He's in his 80s. He's on blood thinners. This was actually during COVID where we couldn't really do a lot of surgery. And Dr. Dulebohn shows you the stenosis. You see clear pinch right there, L4, L5. I mean, he barely has any room.
This is all that he has for the nerves.
Right. So all of that has been pinched there. So this guy is not really functional, but he's scared of surgery because he's not the healthiest person. So he had a 30-minute, 40-minute procedure, outpatient. We were during COVID, so you couldn't stay in the hospital because people were sick. So he went home, and don't take my word for it, he's an architect, so he's visually minded. He says, yay for Dr. Ye and his team. Thought you might enjoy an architect's mental image prior to surgery. Not true. The sciatic nerve pain is gone and the discomfort is minimal. So here you see the guy with the stapler, the undertaker with the shoveler, the Texas Chainsaw Massacre, and he's saying you may experience it. So this is what you think surgery is going to be, but not so, right? Next. So then we talked about the co-fix, which is if you do need a fusion, we try to avoid the screws and rods, and this is another option to consider. Next. So here's a patient, and you can clearly see the pinch at L34, L45, and on the CAT scan on the left, you can see there's really no disc there. So there's really no opportunity to preserve movement because the pressure is too much on the nerves.
No, and this is malaligned.
Right, you see the slippage there. So at this point, this patient shouldn't move there. It's causing them problems. Next. So here's what we did with this. So if you look on the right, you'll see that it's literally about a 3-inch incision. There is a drain because we move quickly and there is some decompression. We want to make sure the fluid doesn't build up. And we've used 2 co-fix devices to lift up the disc. So look at how the height is much better and the slippage is better.
And you can see how we took bone away here and here to help open over the nerves themselves.
Right, so this patient had this surgery and was home within 3 hours. Again, it's not the surgery that you think we used to do. So let's talk about the neck, right? So the neck is different. It's what makes us special as human beings because we have great rotation and we're able to have great flexion. It allows us to do incredible things with our hands, play the piano, things like this. But look at this MRI, and Dr. Dulebohn will show you where L4, the C4-5 disc is herniated. Do you see that? And see how it presses right on the spinal cord. So typically that will present as numbness, tingling in the arms, weakness, and you may actually start having problems walking. So that's called cervical stenosis. You see the pressure on the nerve roots? This is again a CAT scan. So we may ask you to get this procedure so that we can look better. And you see how there's a pinch on the right side of the nerve, right? You see there's just not enough space there. And then on the left, there is more space.
And this is left, this is right. I know it seems backwards, but it's just lying down.
Right, so the patient, if you can imagine your nerve just being pinched like that all of your life, that's miserable. So, next slide. So, sometimes we have to do this. This is a fusion. That's where we take off the pressure, we increase the height of the disc space, and we put in a screw and rod, and that's called a fusion. This is a great procedure. People do very well. We've been doing this for 50 years, really. Next paragraph. But what if we could take out the disc and instead of fusing, replace the disc? This is like the bionic man sort of idea, right? So you see how the disc comes in, and basically you have the same movement?
And this is a movable part.
Right.
This joint is an end plate, and then a movable piece.
So Dr. Dulebohn talked to you about this product, which is really quite impressive because there's 4 different products. So during surgery, we take out the pressure of the spine and nerve roots, and then we look at the disc space. And then depending on how the disc space looks, we replace that disc and give you a new disc. Next. All the different variations, because everybody's different. So here's a case of, and I'm going to show you 2. So this is a younger player. He's 40 years old. He has pretty severe degeneration, and you see the pinch there. But more specifically, Dr. Dulebohn will show you where the pinch is on the left side, right there. And again, it doesn't look as bad as some of the pictures we've seen, but it's very, very hard to live like that because your arm's always tingling, burning, and for a 40-year-old patient, this is hard to live with. So he saw me in clinic. We got a CAT scan, and you see why the CAT scan is so good, because you see the changes at the C6-7 level, the degeneration, the debris there. Next. And so he underwent surgery. This was a less than 1 hour procedure through a 1-inch incision in the neck. We take out the disc and we give him a brand new disc, and it's a beautiful fit. He's right back to surfing again. Next one. And look how he's moving his neck, forward and backwards. Look how the disc allows for the movement.
It changes in position.
No bulky neck brace. Your friends won't even know in church that you have it. You know, just a little ice, wear a scarf. I mean, you're back to driving in a few days. And then what if you're older? So here's a 71-year-old person, and he specifically said, I don't know if you have that here in Ireland, but in California now, people are crazy about this thing called pickleball. So pickleball is like a in between ping pong and tennis, right? And it's amazing because the ball doesn't bounce at all, so you have to scoop it. So it's a lot of movement for the neck. So this guy is a big-time pickleball player, and he has really severe right arm pain, and he can't do what he loves. And you see the pinch, even the spinal cord, you see that white little dot there. You know, this is not something you can just sit on because the spinal cord is being injured. So you have to do something. Again, we get a CAT scan, and you see that there is some really, really arthritic changes. But he said to me, Doc, if there's anything you can do, because I love to play pickleball. I coach, I teach, I do professional things. So we got the final x-ray, and we noticed that at that level, the neck does still move. So even though he's in his early 70s, here's a guy that's active, healthy, and playing pickleball. Next paragraph. Next slide. So 1 hour surgery. You remove that disc, take off the pressure on the nerve root, especially on the right side, and you put in an artificial disc there, and you see him bending backwards and forwards the movement. But don't take it from me. So here's clinic for a spine surgeon is not a fun thing, right? We sit here, you're miserable, you don't want to see us, we're miserable, we don't want to hear your problems. But this is what my clinics look like. So this patient comes after surgery, 6 months, and that's a pickleball. He gives me a racket and these pickleballs. And then he says, Dr. Ye, back to playing 4-0 pickleball translates to successful surgery. Thank you for sharing your great medical expertise with me. I'm grateful. So, I mean, how about that for clinic, right? That's not your same old, in your mind, what spine surgery looks like. So, with just those few cases, I just want to share with you what we've learned. Really, and it's a humbling process, right? Absolutely.
What are your recommendations if I'm having back neck problems? Should I start with a referral to you, or should I start with the referral to a chiropractor or acupuncturist?
I think I would always recommend trying to avoid surgery and go to the chiropractic acupuncturist first, assuming that your primary care hasn't identified that, hey, you've got an arm pain problem or a leg pain problem. It's not your hip, it's your neck. You should definitely see your primary care physician first. And if he orders imaging and it looks terrible, it may be worthwhile to see us more promptly.
All right, we'll come down here.
Is it possible to have surgery if you have osteoporosis in your hip? Is it possible to have spine surgery?
Yes.
Quick question, quick answer. I like that. Who's next?
Is it covered by insurance?
Yes. All of these things are covered by Medicare, TRICARE, the usual insurance companies. You sometimes have to argue to make sure that you're covered, but we only do people really who are insured.
Okay, sir, thank you for showing those success, but what is your overall successful rate for this type of surgery?
So I think Dr. Dulebohn said it best, especially on the island. He can't just do surgeries and go stay in our house. We're out there, we're seeing you. You're going to go out and talk to other people. And so in my experience over the last 10 years, in my town of San Luis Obispo, California, there's about 60,000 people there, and around there maybe 250,000. And so I've done about, let's say, 6,000, 5,000 surgeries, and I cannot keep up with the people who want to see me. And I spend no money on advertising. It's just, we depend on you after having a great surgical experience, feeling better. Not perfect, there's no one who can make you young again. And so any surgeon who sells that, that's not going to work. But you're going to be happy, I believe, and out there talking to other people, and then that brings more people to have the opportunity to get better. So in answer to your question, there's very few people who see me who feel like, well, you messed me up. I wish I'd never seen you before.
Good morning, doctor. I do have my spine surgery, L4 and L5, due to slip disc. And then my question is the disc coming out of the way to my, because I do have now feeling that my neck and my numb.
Well, you're a person that we would need to see and examine. And if you're having neck problems, that's usually a separate problem from your low back.
Yeah.
And unfortunately, it's downhill from age 18. It's a matter of the rate. Okay? And if you've got a low back problem, your chances of having a neck problem are a lot higher than if you didn't have a spine problem at all. And so we would need to image and decide.
Oh, okay.
But we promise we'll see you in the clinic,
Okay.
and we'll give you an exam.
I'm gonna ask my primary doctor.
Yes,
Okay.
and then we'll talk through and we'll give you some options.
Because even my balance now is not good.
I
cannot
totally
walk.
understand.
Yeah. Okay, thank you.
You're welcome. You're welcome.
Hello, specifically to the Bowflex spacer, how would that affect the anatomy of your back as you age? Will when you insert that Bowflex spacer, as you age, because your bones change as well, would that affect the anatomy when you have that spacer in, that you're gonna have to go back in and make an adjustment?
Yes, that's a great question. What's in the future? Okay, so we all know what the future is, and we're not going to talk about that. Right now, we want to enjoy as much as we can life. So Coflex is designed to take pressure off the nerve roots and then stabilize. It may be necessary later to do more. Sometimes people have come back to me with Coflex at above level and below level. It may be necessary to take out the Coflex and convert it to a fusion. But one thing is, patients come back to me and they say, hey, that wasn't a bad surgery, and I was improved. Now, 4, 5, 6 years later, what can I do to maybe do even more? Understanding that you're 6 years older. There's no fix for this problem of getting older, aging. And so I hope that you are intrigued with our headline, which the marketing team, and thank you so much to all of them for setting up this great event. They thought that we should talk about the aging spine, so that's a great question.
I guess I have 2 questions. One was similar to hers, like, have you had a situation where the body rejects the piece? And if it doesn't, because it's been so successful, would you have to, like your 41-year-old guy, is he like in 80 gonna have an adjustment or a change? And then my second question was, for our children, like what should I tell my 40-year-old son that he got that thing that reverts you and you hang upside down? I mean, what are some preventions so that when he's like my age, maybe he won't need the surgery maybe until the 90s? So that's my 2 questions.
So, 2 questions. We did have a handout on back exercises that are all safe and easy to do to try to keep you moving. If you think about things, if your legs are really loose, your back can be tight. And so from that standpoint of how do you get by without anything, that first. In regards to your 40-year-old who needs a neck or back surgery, are they going to need something else when they're 85? Probably. Okay. This solves the issue at that level, okay? 90% of the time.
Simple question, are these services available on island, or do we have to go off island?
No, they're here. They're here. We did 9 surgeries this week at GRMC.
So I think the more precise answer is yes, they're here on Guam at GRMC. Okay, very nice.
Are these procedures applicable to people with scoliosis?
Yes.
Okay. And comment, our doctors, our primary doctors are not aware of this because I was told there's nothing to be done to my back because I'm too old.
Well, we hope that we're never too old for some sort of intervention. If there are other ways of treating your pain, and that's some of the other things that I do, when you can't fix the pain structurally, we have devices to help cover it up.
So it was cut off. So now that I have these in my neck, I still have a lot of facial numbness and pain in my neck and so forth. With your product, can this come out, or you replace, or you enhance to make this better?
Well, we would want to image your neck first and see that. One of the problems you've had is you've had 3 bones fused together in your neck, which then causes a lot more pressure on the disc above, and that may be wearing out, but a replacement might be an appropriate treatment. But we really would need to know you and see. But where you've been fused, you really can't do anything else. That's usually the definitive procedure for that level.
All right, do we have any other questions on this side of the house?
Can you do neck surgery and back surgery at the same time, or they have to be separate?
They always should be separate.
Okay, and the next question is, are you permanently at GRMC, or
Yes.
are you just...
Only at GRMC.
Okay.
Here all the time.
Okay.
Been here since before the storm, as I said at the very beginning, and that was one of the reasons why how everyone took care of each other after the storm made me excited about helping bring spine surgery and neurosurgery forward, and that's the reason why I've been able to recruit David to try to help us build a program so that people on Guam get treated well, as opposed to just taken care of on call.
So if you're having lots of joint pain randomly? I mean, that's something that would say we should come and check you out.
Well, you may have a rheumatologic or some other issue if it's joints everywhere, but we'd be happy to see you and say, hey, this is where you need to go, or this is what we need to do.
Hi, Doc. Good morning. I just have a question. Is it possible to just do a laminotomy without the complex?
We sometimes do that on certain cases.
Okay. Thank you.
All right, we've got more questions on this side. Anybody? No? All right, do we have any other questions at all on the floor? Up front, all right. Can I just say, I'm very glad that you came and you're staying, Dr. D. We appreciate it. Let's give it up for Dr. Dulebohn and Dr. Thank you so much, guys.
So after the surgery, do you need physical therapy?
Some people need physical therapy after surgery, some people need it before. It really depends on what your situation is. And we're very blessed to have really wonderful physical therapy at GRMC. They were here, and often we use them quite extensively. We're going to be actually having them see people in recovery going forward to try to help them even more. Because one of the problems is the patients feel enough better that they don't come back and see us.
Another question is it a bloodless surgery?
Well, we've now had to transfuse for this kind of surgery. Okay? But unfortunately, it's hard to get by without losing a little bit.
I have a problem on my cervical and lumbar also, so I just want to ask if like the disc replacement on the cervical. Have you done like 2 or 3 level? Because I have 3.
Yes, we have.
3 level.
Yeah, the most I've done is 3 levels, but everybody is different. So we have to go through from the beginning, get all the history, get all the pictures, and then based on what that shows, recommend what we recommend, and then we talk about the timing, when to do it. Sometimes we'll do 1 disc, then another disc. Sometimes we'll do more than 1.
Thank you so much.
Thank you. Do we have any other questions? Well, I just want to say, like, you know, we've all probably been thinking, this is something that can be done here on Guam, and it's great to have that opportunity at GRMC. I remember when my grandma needed neck surgery, I went with her, and we had to go all the way to LA to Good Samaritan, and we had to stay there. And just all of that stress, not even on me, because I was living it up. I was like, Disneyland, here I come. But my grandma was not having a good time. And I really wish that this was available back then, because on top of that, the financial stress, the added stress of where am I going to heat up my kimchi bowl, a lot of that all taken care of now. You can have this surgery here in Guam. You can recover at home with your kids taking care of you and heating up your kimchi bowl, and you don't have to worry about it anymore. So again, I want to get a big round of applause for this amazing team bringing this to our island. And they also made a shout out to the physical therapy team. Thank you so much, Anson, for the entire team and all the amazing work you guys do down there. That's my 2 cents. Do we have any other questions?
I just want to say something. Thank you very much. Everybody, my name is Eric Plinsky, Chief Business Development Officer at Guam Regional Medical City. I just wanted to say I came to kind of observe to see how this went. It's really the first time we're trying an event which is focused on the public, on the patient. It can be a highly complex topic. We weren't sure how this was going to go over. I mean, this is an overwhelming success. We greatly appreciate you coming out, for you or a loved one who might be suffering from pain. Dr. Dulebohn and Dr. Ye, I think the most impressive thing too is if you listen to these guys speak and they're not here, they're speaking in a foreign language of technical medical speak, but their ability to come and share their knowledge and their information in a way we can all understand, I think it really hits home so that you can now understand and share with others what we're capable of at GRMC. And this also is setting the stage for other events we're going to bring, because this is such a success. We have all kinds of amazing things that we now feel this platform has shown is successful. So stay tuned for more, and I think our mall partner, what a great place. It's convenient. Micro Mall is a great partner. All our team that took time off today to help share more information at the booths, as well as do health checks, I want to thank all of them. And also our on-call employee, Kyle Mandapat. we don't go to anyone else. When there's an event, he's the one on call. You guys know he's at Power 98 doing a morning show from 6 to 10 a.m. Is that about right?
Yes, sir. Nailed it on the head.
So make sure to tune in to him every weekday, I think. Thank you, everyone. Thank you very much for coming. I appreciate it and look forward for more events like this in the future.
Amazing. Thank you so much, BD. And again, ladies and gents, this is for you. Patients are partners at GRMC. Let's get a round of applause one more time for the doctors. Thank you, Dr. B, Dr. Ray. Amazing. And again, like I mentioned earlier, guys, if you want more personalized care, a little bit more time with the docs, we have a sign-up sheet back there with Nurse Jen in neurology, and you can sign up, put your information, and then they'll give you a ring.